Spondylolisthesis. So you've been to the doctor because you have back pain. They did an imaging test, either an X-ray or an MRI most likely, and they told you you have a spondylolisthesis, and this is what's causing your back pain. The next conversation that often happens is the doctor says you need to have surgery, especially if you're seeing a surgeon. And so now you feel like there's no way to get rid of your back pain because you have a spondylolisthesis and there's no way to cure it naturally. I'm Dr. Amy with Physical Therapy for Everybody, a PhD orthopedic manual physical therapist, and I am here today to talk to you more about spondylolisthesis, what it is, and if you indeed can get rid of your low back pain without having a surgical correction of your spondylolisthesis. And if that isn't enough of a reason for you to listen to me, I can tell you that I have a spondylolisthesis on X-ray that has never been treated with surgery. And no, I don't walk around with back pain all the time. So first off, what is a spondylolisthesis? Many people are confused about this. Maybe they've looked on the internet and it's difficult to understand exactly what it means. So the general meaning of a spondylolisthesis is you have a vertebrae. So the vertebrae are stacked up on top of each other. They make your spinal column. And one of the vertebrae has slipped. Now, spondylolisthesis is more of a general term. If you have what's called an anterolisthesis, it goes forward. If you have a retrolisthesis, it goes backwards. A spondylolisthesis is basically, it's moved either forward or backward, and it can even be twisted or a little bit side bent. So spondylolisthesis is more of a general term. Now, how do you know if you have a spondylolisthesis? Well, the only way to truly know if you have a spondylolisthesis is by some form of imaging, usually an X-ray or an MRI. But obviously, there's some symptoms that you start having that lead you to go to the doctor and get the X-ray or MRI. So most commonly, people will have either back pain, buttock pain, numbness and tingling that's in their low back, but most commonly in their legs. And they may even have numbness and tingling that goes into the feet. You see, when there's a slippage of the vertebrae, it can put pressure on the nerves. So you can see these nerve roots coming out here. So when the vertebrae moves on the disc, so the disc is in between the vertebrae, when that moves, it can make this hole that this nerve comes through smaller. So then that can put pressure directly on the nerve. In addition to that, it is possible that when this vertebrae moves and slips on the disc, it causes inflammation. And the inflammation that is surrounding the nerve root irritates the nerve root. Now, this can happen directly to the nerve root, and you may have symptoms in your leg that go along a particular dermatome. The dermatome is a particular area that is innervated specifically by that nerve. So some people will have pain or numbness and tingling in that particular dermatome pattern because it's affecting one nerve root. However, these nerve roots down here also join together to form the sciatic nerve, as well as other nerves, but the sciatic one is most commonly recognized. So the sciatic nerve comes together from nerve roots L4 through S1. So these nerve roots come together in the pelvis to make the sciatic nerve. Now the sciatic nerve runs down the back of your leg. At your knee, it goes down the side of your calf as well as the back of your calf and into your foot. So you may have pain in a sciatic nerve distribution, and it can still be from a spondylolisthesis that's only affecting one of the nerve roots, because when it affects one of the nerve roots, it can affect the entire sciatic nerve. Because if one of those nerve roots is irritated, it's going to start talking to all the others. So you have this vertebrae that slipped. You may have been diagnosed with the spondylolisthesis on X-ray or MRI. You may even be having some nerve pain that's going down into your leg. And the doctor has told you that the only thing you can do to fix your spondy is to have surgery. Now, I will tell you that yes, if you want to put that vertebrae back where it's supposed to be, you definitely do have to have surgery. Once a vertebrae has slipped, it's going to be much harder to get it to go back where it's supposed to be, even using holistic techniques. Or at least I should say we have no way to prove it. You see, here's the thing. People get diagnosed with a spondylolisthesis via X-ray or MRI, then they go to somewhere like physical therapy and get help and relief from their low back pain and even their sciatic nerve pain, and then they think, oh, my spondy is fixed. The challenge is we can't actually say that that's true because, of course, nobody's going to do an x-ray after the back pain has gone away. So there is no research to indicate that a spondy actually gets fixed or goes back where it is supposed to be. What I can tell you is there is plenty of research of people who have been diagnosed with a spondy who are living life pain-free and doing all the things that they want to do. And I will tell you that I am one of them. You see, when I was in my final year of PhD training, we were doing some really advanced manipulations. So before that, we had to do full spine x-rays. And when I got my spine x-rays back and my class saw them, I will tell you, my professor turned around and looked at me and said, Amy, whose x-rays are these? You see, they were all digital and I had them on my computer. That's why he was asking me. So I told him, well, those are my x-rays, sir. And he looked around at my entire class and made sure to look all of them in the eye and said, you will be very careful with this one. Because, friends, the truth of the matter is my spine is kind of a mess. You see, I grew really, really fast when I was young and became really, really tall, which meant I wanted to bend forward all the time because I didn't want anybody to notice me. In addition to that, I had 2 vaginal births, and that became very difficult for my pelvis to maintain its normal alignment. These are things that I continue to struggle with to this day, and all of that abnormal movement meets in my lumbar spine. So my low back, the 5 vertebrae in my lumbar spine, do not point in the same direction. None of them. And I can tell you that none of them point in the right direction. However, I am able to do everything I want pain-free. I am able to train for the Dopey, which is 48.6 miles over 4 days, and that's coming up in 2 months, and I fully plan on finishing that with no low back pain. I'm able to bend, I'm able to lift, I'm able to walk, I'm able to hike, swimming, biking. I am not limited to any activity by any kind of pain. Now, there's some things that I just don't want to do. I don't want to ever jump out of an airplane with a parachute. I don't want to. Not because I'm worried about low back pain, just because I don't think that's a good idea. But I digress from that. Well, the truth of the matter is we've got to fix the root cause of your pain. And although you may have a spondylolisthesis, that may not be what's causing your pain. It could be that there's muscle tension. It could be that the ligaments are abnormally stretched. It could be that the nerve has too much pressure. It could be that there's inflammation around the nerve. It could be that you keep having too much force going through your low back because your abdominals are not strong enough. There's a lot of reasons that can actually be the root cause of your pain. And though the doctor will say it's a spondylolisthesis, it's actually the effects of the spondylolisthesis that are actually causing your pain. And this is why it's really important to work with a manual physical therapist, somebody who understands how all of these things are connected, because every body is different. Now you know how I got the name for my company, Physical Therapy for Everybody. Every body is different and every body's story is different. So you are capable of returning to all the activities that you love doing with the spondylolisthesis and being pain-free, but you need some help in figuring out how to get your body moving correctly. Now, there is a caveat. There's always a caveat. In that, some people will have a traumatic spondylolisthesis. So this is some type of accident. It may be a car accident. It may be a fall from a height. Some people may have a traumatic spondylolisthesis where that vertebrae is slipping around and it is unstable. Now, that is a different situation and not what I'm talking about in the rest of the video. If you have had a fall and they are telling you that you have to have surgery to stabilize your low back, chances are good you probably do need to have surgery. Because if your low back is unstable, then you're never going to be able to get proper movement. Everything's always going to be abnormal movement, which is just going to lead to more pain and suffering in the long term. So I will say that that is a different story. If you have a traumatic accident that causes spondylolisthesis, then probably chances are good that you are going to need to have surgery to stabilize this. And I'm terribly sorry for you because there's going to be ramifications of having that surgery, but sometimes that's the best thing for you, even though the side effects of it aren't great. So if that's you and you have had a traumatic accident that causes spondylolisthesis, and I'm talking about recently, like within the past week or month, and the doctor's telling you you need to have surgery, that is probably true for you. Now, if you had a traumatic accident 5 to 10 years ago and you have just been diagnosed with the spondylolisthesis and you were able to get pain-free after that accident, even though you may have had the spondylolisthesis that happened at the time of the accident, well, that's a different story than you apply with the rest of this video. And the fact that if you were ever pain-free after the accident, then you may be able to get pain-free again. And if you're someone who had an accident 5 to 10 years ago and you have never been pain-free since then, and you're wondering if you do need to have surgery for the spondylolisthesis, my question would be is, are you stable at this point? Because chances are good that your body has kind of tightened everything down to keep you stable because you keep doing the things you want to do, which means you may benefit from manual physical therapy to get things moving more correctly. Chances are good if you've had any kind of traumatic accident that things did not resolve on their own or the pain did not go away on their own, that there's now some scar tissue and some abnormal movement. And sometimes just restoring that normal movement and eliminating that scar tissue can get you back to living a pain-free life. Now, if you'd like to learn more about my story and how I understand everything is connected in your body through my journey with spondylolisthesis and all of the things that I have dealt with, I'm going to encourage you to check out my book, Movement is Life. In that, we talk about the important things that you can be doing right now to decrease your inflammation, improve your healing, and see how your whole body's all connected.